This is a WMBD News special investigation. Medical marijuana lessons from a neighboring state.
It's going to take my whole body eventually. You fight.
We have seen, not only in Michigan, but also in other states, where this lack of regulation of the purity and the strength of the marijuana has resulted in real tragedies.
There are some legal dangers that we know are going to exist.
If medical marijuana can improve the lives of individuals, then I think that's a good thing, so long as we don't have abuse.
It takes a lot of work and a lot of effort to do this, and if I was trying to do this by myself, that's why we're all involved. We're on a mission from God.
It's an issue people have strong feelings about, but like it or not, medical marijuana is happening in Illinois.
That means people will use the plant tetrahydrocannabinol, or THC, its cannabinoids, and extracts to treat a disease or symptom.
The federal government classifies marijuana as a Schedule I drug, meaning it has no accepted medical use. But states are making their own rules, passing their own laws for medical marijuana and patients who need it.
Illinois is one of 23 states, along with the District of Columbia, to allow some form of medical marijuana use.
This all started back in 2013. That's when then Governor Pat Quinn signed into law the 4-year pilot program. It took effect in January of 2014. In September of that year, doctors and patients could submit applications to take part. In February 2015, the state awarded licenses and permits to cultivation centers and dispensaries. But as of this month, no medical pot can be purchased.
Cultivation centers and dispensaries are spread out based on state police districts. In central Illinois, each district can have 1 cultivation center and up to 3 dispensaries. Cultivation centers where marijuana is grown and packaged are usually in rural areas. It's then shipped to dispensaries where patients can buy it.
Strict rules are in place. You can't grow your own. Registered patients and caregivers can only possess up to 2.5 ounces in a 14-day period, but patients can request a waiver to get more pot. The marijuana can only come from the dispensary on their application, and Illinois ID is required. By the time you could buy pot, it could run you $400 or more per ounce. Now keep in mind, marijuana is still against federal law.
Back to the states that have medical marijuana. Michigan and Illinois are the only ones in the Midwest with a medical marijuana law for more than a year.
Our state law was crafted with Michigan in mind, so we went there to find out how it's handling implementation nearly 7 years later.
And grow operations in Illinois cost millions of dollars and come complete with CEOs, chemists, and high-tech security.
In Michigan, you won't find cultivation centers.
Just people like military veteran David Overholt.
I ran this farm on those drugs until the drugs overwhelmed me finally. And I didn't really realize whether I had ever been healed or helped by all the operations.
Using marijuana, David Overholt weaned himself from 80 milligrams of Oxycontin taken every day for 9 years.
This is a medicine. It's really a medicine, and we have to be able to grow it.
When medical marijuana was legalized in Michigan by a 2008 ballot initiative, the new law left many gray areas to be sorted out by the legislature and legal system. Overholt lives in West Michigan's Montcalm County, where he farms corn, soybeans, and marijuana. He's had his land rezoned so others can grow marijuana too.
Marijuana is a very exciting crop. It's not like corn or soybeans. It just takes a lot more attention, a lot more intelligent farming.
A patient caregiver in Michigan, like Overholt, can grow up to 72 plants, 12 for himself and 12 for each of his 5 patients.
Crops like this take seasons. Humidity, temperature are 2 major factors in getting a marijuana plant to actually mature and grow and fulfill its life expectancy.
In central Illinois, outside of Delavan, Revolution Enterprises is building on a much bigger scale, a 76,000 square foot facility with a $23 million price tag.
Because of the strict regulatory environment here in Illinois, which we like, and the rules of pesticides and some other things, you need a very, very controlled environment.
Tim McGraw is the CEO of the company overseeing Ace Delavan and Ace Berry cultivation centers in Illinois. Built on farmland, the center has room for all phases of vegetation of the marijuana plant, 20 rooms for the flower stage, laboratories for testing, and rooms for trimming and packaging product.
We already have on staff a PhD geneticist, as well as an analytical chemist. We are, I don't know if we've hired yet, but we're looking for or just hired a food chemist. So helping the formulation of our edibles.
The security both in and outside the Delavan facility is 24/7 with surveillance cameras and hired guards outside and bulletproof drywall, security cards and codes inside. There's also a heavy focus on biosecurity because of all of the strict rules on pesticides for medical pot in Illinois.
Anybody that comes in, that goes into the operational side of the facility, has to shower. We have misters that spray with surgical soap, foot baths. You wear Tyvek suits.
Each batch of product sent out will also be tested internally and by a third party. McGraw says he actually tried to start his business in Michigan 3 years ago.
Once I realized that it just wasn't commercially viable, I started seriously considering Illinois.
Now he's looking forward to products hitting shelves in the fall. Now, grow time varies based on the strain.
The plants meant for oils grow in 10 to 12 weeks, while high THC plants can take up to 18 weeks to mature.
Now, marijuana is a powerful drug because of a chemical referred to as THC or tetrahydrocannabinol. The chemical affects receptors in our brains that involve appetite, mood, memory, and pain. The concern about THC in marijuana is that it has psychotropic side effects affecting mental activity. There's another chemical in marijuana called CBD, cannabidiol. People taking it get pain relief similar to THC, but it doesn't get you high, which is why kids are given marijuana high in CBDs, not THC.
Because of the chemicals in marijuana, Illinois drafted a list of ailments a patient must have to qualify for a medical marijuana card, including AIDS and HIV, ALS, cancer, lupus, Parkinson's, and seizures. There are recommendations to add a number of other illnesses, including PTSD.
My girlfriend had me try it, and I thought, oh my God, my pain is gone.
She'd resigned herself to the pain until marijuana came into the picture. Her story of struggle still ahead.
And an Illinois family takes part in a unique marijuana trial. We'll check in with them to see whether they think it's working.
At Trouble Free, we focus on making sure that our technicians are fully trained on every system for every situation and keep you and your family trouble-free. For more information, go to troublefreeinc.com.
How do you connect with your customers while staying ahead of the digital revolution? Tactive Digital is the partner you can rely on to help navigate the ever-evolving digital marketing landscape. To schedule your free digital analysis, visit tactivedigital.com.
We're installing new equipment and advanced technology to improve reliability. It's all part of Cameron, Illinois' 5-year plan to build a stronger energy infrastructure. Along the way, we're also building a stronger economy in central and southern Illinois by hiring more than 800 new employees. I should know. I'm one of them. Cameron, Illinois. Energy at work.
When you enter, you're Irish at Kelleher's Irish Pub and Eatery, and 100,000 welcomes are extended to all. Kelleher's is the perfect gathering place. The casual pub atmosphere makes you feel right at home. Kelleher's serves up plenty of good food and drink, with a variety of traditional Irish fare, lots of American favorites, and a large selection of microbrews, import drafts, and close to 100 different bottled beers. Next time you're out, stop in. Kelleher's Irish Pub and Eatery, downtown at State and Water on Peoria's riverfront.
There's a difference in local news. Try us and see for yourself.
Maria Chandler, weeknights at 6 and 10 on WMBD News, Central Illinois Proud.
From debilitating pain to appetite-zapping chemotherapy, people are exploring medical marijuana to address an array of ailments.
We sat down with a woman in Michigan who turned to marijuana after traditional medicine failed her. Susan Baxter says the way her body works even baffles her doctors.
My body is, I'll tell you, I think I should donate to science because it's got a lot of weird things.
She's 50 plus and has lived with neuropathy for years.
I have all the things where it's shocking pains, like you stuck your finger in a light socket, that kind of feel.
Before finding medicine that helped her, she was hopeless.
When I didn't have anything, before Lyrica came out, when I didn't have anything that was helping me, I was to the point where I was, and I never wanted to ever think this, but I wanted to kill myself.
But even after Lyrica, a recommended dose didn't do enough for her pain.
And I was taking 900 milligrams and they only suggest 400 for a day. That didn't work for me. As I was taking it, months down the road, I was like a zombie.
That's when Sue said she became her own advocate and tried medical marijuana.
I thought, oh my God, my pain is gone. How can this be? And I told my doctor, and she has never prescribed it for anybody. And she said, Sue, if that works, you will be my first person, I will do it for you.
Soon, Sue was able to advocate for other patients.
I was stopped, and a gentleman in a pickup truck was not paying attention and hit me at 60 miles an hour.
Carol Teft had multiple surgeries after the wreck, surgeries that didn't heal her.
I also have lost the fluids in my spine that prevent the bones from pinching on the nerves.
Sue hoped if medical marijuana could help her, it could also help her friend.
She had talked to me about it for a while and then asked my husband and myself over.
It does work. It does work. And I was the biggest skeptic. It's helped me so much. It's brought my life back.
These women admit medical marijuana may not be for everyone. But once the biggest skeptics, they're hoping their stories will help break stereotypes and spare people from a life dictated by pain.
I'm so thankful for the doctors that do believe, because I do believe God will reward them, because they've saved lives. They've saved lives.
Where it's going, rather than is he having a seizure.
A local 5-year-old boy is finally acting like a 5-year-old boy, thanks to a medical marijuana trial he started in the spring. We first introduced you to Owen a year ago. The Morton boy has a severe form of epilepsy called Dravet syndrome.
And instead of waiting around for the state to okay medical marijuana, Owen's mom enrolled him in a cannabis trial out of Chicago that's soon coming to an end.
WMBD's Hannah Hilliard has been following this story from the beginning. She joins us now tonight with more. Hannah, how has this trial been going?
Well, Paul and Maria, Owen's mom, Stephanie Sailors, is shocked at just how successful this trial has been. But the process she's had to go through just to get her son some relief is what's making her frustrated. Stephanie Sailors and her son Owen are no stranger to medication.
Been put on Trileptal, Topamax, Depakote, Keppra, all kinds of medications that most of them made him worse.
And Owen is not alone. Owen's relative, who also works for the local Epilepsy Foundation, sees the same problem.
They're drugged up. They have no life. They have no personality. The quality of life is poor.
But as of right now, that's not the case for Owen, who is more than 2 months into a medical marijuana trial.
It's just been a miracle drug.
For some reference, during Owen's first month of the trial without any oil, he had 34 seizures. In May, he started taking some kind of oil, either cannabis or placebo. They don't know which it is yet, but either way, his mom says it's working.
He took his first dose of oil on May 5th, and he's had 2 seizures since.
He's had fewer seizures and is acting more
It's me.
like a regular 5-year-old boy.
What we're seeing in the early stages as he started is that his seizures have been reduced and he's much more socially active with his peers, at least from what we see.
Now he's doing like 100-piece puzzles, and he's back to doing those all the time. He can sit down and look at a book.
There hasn't been a huge shift in his behavior yet, but Sailor says that may be because he is still on his other meds.
I know that we could cut them out mostly, but we would have to wean him down, and we're not allowed to start that until his next appointment when we know for sure if he's getting the oil or not.
But even with the medication,
I got it.
she's just happy to have her little boy back.
Yeah, a little crazy Owen.
Thank you.
Now, Owen and his mom will find out whether he's been taking a marijuana-infused oil on August 11th. We will continue to follow his story and let you know how he's doing.
Thanks, Hannah. Still ahead, you've heard from patients about how medical marijuana can help, but how do you join the program? We'll explain how to apply for a card.
One of the problems I see with medical marijuana is how it's perceived by the public and by physicians in general, for that matter, in the eyes of the law.
And we hear from doctors about why they have concerns about certifying patients for the medical pot program.
During the summer savings event at Furniture Row, you can find huge savings store-wide, including new arrivals, final markdowns, and up to 50% off all outdoor furniture, plus 0% interest for 4 years. Hurry! Summer savings ends soon.
Hey you beautiful dreamer. You know what you need? A champion. At American Family Insurance, we support the dreamers. It's a commitment from people who know what it takes to get here. That's who we are. We don't sell insurance. We insure you, because your dreams are the most valuable things you will ever own.
At Osling & Associates, we handle bankruptcy and only bankruptcy. When you need help, call Osling & Associates. There's only a $650 fee for single filing Chapter 7 bankruptcy. Bankruptcy questions? Visit our website at bcyhelp.com. An emergency bankruptcy can stop foreclosures, judgments, repossessions, utility shutoffs, court proceedings. Call Osling & Associates with 20 Illinois offices to serve you. Call Osling & Associates now and stop the collection calls.
To be at their best, your kids need their rest. Help them get it at the back-to-school sale at Denver Mattress. Choose from 2 of our best-selling twin mattresses, just $199 each, including the Space Base. Better tomorrows start tonight at Denver Mattress.
Here's a look at what you need to do to get a medical marijuana card.
You have to go to a licensed doctor of medicine or osteopathy, and there must be a true doctor-patient relationship. Now, if you're a veteran who gets treated at a VA hospital, you don't need written certification, but you have to show your paperwork. Everyone has to be fingerprinted and complete a background check.
And the fee to apply is $100. If you're on Social Security disability, it's just $50. The annual caregiver's fee is $25. The caregiver has to be chosen by the patient, and they cannot use cannabis. Getting a medical marijuana card takes several steps.
And while some say it's easy to get approved, finding a doctor who will say a qualifying patient needs the drug can be tricky, and that's just the start.
So our patient comes in to our clinic and they give us their story and we write it down.
Dr. Richard Piazza has been a family practitioner since 1992. He started working with medical marijuana in 2008 after it became legal in Michigan. Since then, he's heard several stories from people who tried to get a medical marijuana card.
Now, show me your medical records. Well, I haven't seen a doctor in 20 years. What do you mean you haven't seen a doctor in 20 years? When did your car wreck? 21 years ago. And I said, okay. So how can I prove that you have what you say you have?
Patients trying to get a doctor to sign off must have at least one or more than a dozen qualifying conditions and a genuine relationship with their doctor. Dr. Thomas Goldman with Unity Point Clinic in Peoria has been practicing medicine for more than 3 decades. He says understanding a patient's ailments doesn't necessarily mean he's comfortable prescribing marijuana.
We all know patients who have said, I use marijuana regularly and my symptoms of X, Y, or Z are better. That doesn't allow me to prescribe it. I'm not sure what their dose is. I don't know, even if I know how often they use the drug. Are they inhaling it? Are they eating it?
Goldman is part of a team of medical professionals working on hospital policies and procedures for the medical community in Peoria. He says doctors need to be confident when they write any prescription, especially marijuana.
How do I know that this individual doesn't have a record of drug abuse in other places? Am I going to be, even if he doesn't, if I prescribe to this person, am I going to be inundated with other individuals whose records perhaps aren't as clean? Am I going to be a magnet for drug abuse, essentially?
Once a patient gets a completed physician certification form, they must fill out an application and send it to the state, which will decide whether to approve the application. Now, in Illinois, a medical marijuana card is good for 1 year. A patient needs to reapply at least 45 days before the card's expiration date.
Thousands of people are actively working to get a medical marijuana card in Illinois. According to the latest numbers, 22,600 people started the Illinois Medical Cannabis Pilot Program patient registry application process. About 3,200 people have submitted a completed application. 2,600 approval letters have actually gone out. Some are worried that this number is low. We'll explain why there's that concern. That's later in the show. And patient approval isn't an easy process. An attorney who helped write the law says education's everything.
But there's an obstacle preventing the medical community from getting the information it needs.
Right now, doctors are scared to death to be involved in the medical marijuana business because we are evidence-based physicians and you have to prove something 100 different times before you're going to believe it once.
That research hasn't been done in the United States because marijuana is a Schedule I drug.
And unfortunately, Schedule I drugs like heroin, LSD, PCP, and marijuana are stated as Schedule I because they have no clinical significance.
That leaves doctors in the dark.
We're in this transition, so maybe this isn't a drug that we should all avoid. What are we going to do with it? How are we going to know that?
Perception will change if the federal government takes action, but it hasn't been friendly to studies on marijuana's medical benefits.
They have actually prevented studying of the good products of marijuana, and most of the studies have been done with the male sterile product, which is what makes hemp, and there's really no clinical significance to the male product or to hemp. We have to study the female plant.
These studies would allow scientists to break down the marijuana plant to determine which parts are most effective as medicine, as well as how to dose a particular diagnosis. just like what's done with traditional pharmaceuticals.
We toxify our patients terribly. And then we take a medication for something, and then we have to take another medication to combat the side effects of that medication. And I have patients taking 15 drugs to take care of one problem. And that's awful.
But these practices won't change overnight.
We need to educate ourselves. We need to see, I think most people are pretty open-minded about it anyway, but even if you're a physician who is very conservative and doesn't think it has much benefit, I think an education will help that.
Earlier this month, a group of Democratic senators sent a letter to several federal departments requesting more information about their efforts on medical marijuana research. Now, it comes more than a year after a bipartisan congressional group sent a letter to President Obama asking him to reschedule marijuana.
For some people, cultivation centers and dispensaries are in their backyards. How police are hoping to weed out worries about the new neighbors.
And following the money of medical marijuana, the drug is still illegal in the eyes of the feds. What that could mean for banks, we'll explain.
Hey, what's up? Feeding my water softener again. You should get Culligan water, man.
A Culligan whole house water softening system is more efficient than your old softener.
Get a Culligan water softener for only $9.95 per month for the first 3 months.
For a weekly traditional Christian worship service where the Bible is preached, join us for the Christian Worship Hour. Pastor Harold E. Salem's message will be an inspiration to you and your family. Our service always includes special musical presentations to help celebrate the glory of the Lord Jesus Christ. Join us this week on this station for the Christian Worship Hour, a traditional service where the Bible is preached.
Sam Lehman of Morton is moving, and we would rather sell them than move them. So hurry in for the Sam Lehman of Morton Summer Clearance Event. Right now at Sam Lehman of Morton, get a brand new 2015 Ram 1500 for just $21,990. Plus at Sam Lehman of Morton, you can drive home a brand new minivan or a Dodge Journey. Your choice, only $17,990. Or a brand new Jeep for only $13,990. But only at the #1 Ram dealer in Illinois, Sam Lehman of Morton.
The electricians Nika IBEW joined WMBD and WYZZ in saluting the Illini Bluffs Wrestling Tigers with 8 sectional and state qualifiers. The spirit of excellence.
Banks who are really chartered by the national government have been very cautious about working with these types of businesses, not because they have any moral objections, but simply because it's against federal law.
The CEO of the Delavan Cultivation Center says he's working with 5 state-chartered banks, which are not backed by the federal government. U.S. Justice and Treasury departments gave the green light last year, making businesses with medical marijuana facilities easier, telling U.S. attorneys not to go after banks working with those cultivation centers and dispensaries as long as they're following the law. Now, there are many more concerns about the state's pilot program.
And regardless of what happens next, everyone agrees it will change Illinois forever.
We actually in Illinois started with a program in the bill that was much more similar to the Michigan program.
That's not what lawmakers in Illinois wanted. Instead, they adopted something Jones Day attorney Eric Berlin says was right for people living here. Berlin helped legislators draft the law, making sure it was different from our neighboring state.
I do think that our system in Illinois will be better in a lot of ways.
But wanting to be different could be blamed for over-regulation in the land of Lincoln, which could lead to patients paying more for pot.
The regulations are incredible in terms of security that cultivation centers and dispensaries need to have.
Democratic State Representative Jeff Irwin of Michigan agrees that regulation may be too much, but in some ways he's looking to Illinois as a program to follow.
It's terrible that the courts and the legislature have essentially failed to deal with this issue, and that we're forcing grandma who is diagnosed with painful cancer and who wants to get a little bit of relief, we're forcing her to go to some shady source.
Right now, edible medical marijuana in Michigan in the form of candies, brownies, oils is illegal. The law only says a patient can smoke it.
As a physician, I really don't want anybody smoking anything. I don't want you to smoke cigarettes, cigars, I don't want you to have a pot-bellied stove. I want your lungs to be sterile, but unfortunately in Michigan you can only smoke the bud or the leaf. You cannot consume edibles, medibles, or oils. That's wrong, and our government has to fix that immediately.
Patients have more choices in Illinois.
Here there was a real distaste for smoking or even vaporizing, which people kind of had a vague understanding of at the time, I mean the legislators. And people say, well, medicine shouldn't be smoked.
But there's concern about the amount of patients who will actually end up using medical marijuana.
I can say without revealing attorney-client privilege that to say that the cultivation centers and dispensaries are concerned about the level of patients is a vast understatement.
Democratic Illinois State Senator Dave Kaler of Peoria voted for the pilot program. While he says he wishes the implementation would have been better, he isn't as worried about the low number of patients in the state.
We were told there is a market, there's a need medically for this. Beyond that, our job is to make sure that the legislation is done right.
While the long-term future of Illinois' medical marijuana program is unclear, the pilot program is set to expire at the end of 2017. A bill is sitting on Governor Rauner's desk waiting for his signature to extend the program 4 more years.
Law enforcement is also raising concerns about the new law.
We asked local and state police as well as a state's attorney to share their thoughts about the pilot program. And as you might expect, state budget talks are having an impact on the pilot program. Illinois State Police were supposed to have funding for dispensary and cultivation center inspections. ISP tells WMBD, quote, due to the current budget impasse, the inspector contracts were not renewed. ISP is using existing staff to inspect facilities until the contract can be renewed.
In central Illinois, the police and prosecutor have their own thoughts about the medical pot law, including the impact it will have on the road.
I think probably one of the biggest problems is going to be how we're going to monitor the driving behavior. Statute says they have to be impaired.
They're at Forest Hill University, close to residential neighborhoods. So one of our big concerns will probably be watching and see increased traffic in the neighborhoods, vehicular or foot traffic, and seeing what concerns that presents to the neighbors.
The concerns don't stop there. Caregiver legitimacy and how a legal drug trade will impact street prices are also on the radar of law enforcement.
The pilot program is also surrounded by optimism. New jobs means new money and investment to communities, thanks to those cultivation centers and dispensaries.
Each step forward of medical marijuana also increases the likelihood the federal government will reschedule the drug, opening the doors for more scientific research into the plant's potential benefits.
There's more information available online, and you can find those links on our website, ciproud.com. Thanks for watching.
The views and opinions expressed in this program are those of the participants and do not necessarily reflect those of WMBD, WYZZ, or Nexstar Broadcasting Group.